This professional development presentation has been developed by the College of Pharmacists of Manitoba. It is a prerequisite for prescribing for self-limiting conditions and smoking cessation in Manitoba. In this presentation, we're going to review the applicable sections of legislation, standards of practice, and practice directions related to prescribing drugs for self-limiting conditions listed in Schedule 3 to the Pharmaceutical Regulation, the fundamentals of all prescribing, safe prescribing practices, appropriate documentation, and ways to integrate prescribing for self-limiting conditions into your daily practice. Before we begin, we'd like to acknowledge these organizations and individuals for their work in this area. Let's start out with legislation and practice directions. Before we take a closer look at the legislation, it's important to understand that there are 3 types of pharmacist prescribing. There are drugs or devices that any licensed pharmacist can prescribe. There are drugs that licensed pharmacists with additional training and authorization can prescribe. And there are drugs that extended practice pharmacists can prescribe. The key legislation that allows members to prescribe is Section 118 of the regulation. Let's look at its first few subsections. Subsection 118 bracket 1 allows all members to prescribe NAPRA Schedule 2 and 3 drugs, drugs not listed in the NAPRA schedules if they have a DIN or NPN, as well as medical devices approved by Health Canada. After completing all prerequisites, including this training presentation, and receiving the appropriate approvals from the college, you will also be able to prescribe under subsection 118 bracket 2, which allows pharmacists to prescribe a drug included in the category for a condition listed in Schedule 3 to this regulation. The Pharmaceutical General Matters Regulation to the Pharmaceutical Act designates pharmacists as practitioners, which allows pharmacists to prescribe Schedule 3 medications. Schedule 3 lists all the categories and drugs that pharmacists can prescribe after receiving authorization. For each condition, there is a list of drugs that a member can prescribe once the applicable program has been successfully completed and authorization obtained from CPHM. The drugs are listed by their prescription drug category, or Anatomic Therapeutic Chemical Classification System, which is controlled by the World Health Organization Collaborating Center for Drug Statistics Methodology. A link to the list of drugs can be found on the college website. In addition, subsection 118 bracket 3 allows extended practice pharmacists, or EPPHs, to prescribe Schedule 1 drugs within their specialty area. Finally, if the province enters a state of emergency that requires pharmacists to prescribe any drug not listed in subsection 118 bracket 1, the Minister of Health notifies the College Council, which then may approve pharmacists to prescribe drugs under subsection 118 bracket 4 until the state of emergency is over. To reiterate, in the case of a public health emergency in all or part of the province, the Minister of Health will provide the College Council written notice of the emergency. Under such conditions, Council may approve additional prescribing privileges to pharmacists. The Registrar will then notify all pharmacists in the province of the emergency prescribing measures that would remain in effect until the state of emergency ends. As of July 2020, the only emergency measure approved by the College Council is the Emergency Continued Care Prescription Process, as described on pages 6 and 7 of the Emergency Preparedness Resource Kit for pharmacists. Prescribing must be in accordance with applicable practice directions. In the next slides, we're going to take a closer look at these applicable practice directions and associated regulations. Please note that all the relevant practice directions must be reviewed in full by pharmacists who are prescribing, as this presentation only highlights sections of the documents. The first practice direction we will discuss is the prescribing practice direction. Pharmacists must only prescribe a medication when it is in the patient's best interest, bearing in mind the risks and benefits as well as any other relevant factors. Pharmacists are allowed to prescribe medications for an indication approved by Health Canada and as considered best practice or accepted clinical practice. Pharmacists may also prescribe where the intended use is part of an approved research protocol. Furthermore, pharmacists can only prescribe drugs or devices for which they have the requisite knowledge, skill, and judgment. Pharmacists must be knowledgeable about the therapy and condition they are prescribing for. A pharmacist who issues a prescription must reduce the prescription to writing and ensure that it is clear, concise, and contains all the required information. Such a prescription can only be made after a patient assessment, which must occur face to face, whether it is in person or by telehealth or video conferencing. There are, however, two exceptions to this requirement. The first is in the case of an extended practice pharmacist who is prescribing for a patient that another healthcare provider in their team has assessed for the same indication within a reasonable time frame. The second exception is when an in-person follow-up with a regulated healthcare provider has been arranged. Sometimes the assessment that precedes a prescription will require the use of medical equipment. In such cases, the pharmacist must ensure that the equipment is in good working order. The patient assessment must also include demographics, symptoms, lab or test results, medical history, allergies, current medications, previous treatment, pregnancy or breastfeeding status, if applicable, and patient preferences. The patient must be presented with therapeutic alternatives and adequate information to make an informed decision. All the documentation related to the assessment and prescription must be readily accessible and open to regulatory review. What documentation is required, you ask? Pharmacists must maintain a record of the patient's name, address, date of birth, drug or device prescribed, strength, quantity, directions for use, refills, name of the licensed pharmacist, and date of prescription. Pharmacists must also document the treatment goal, diagnosis, or clinical indication, rationale for prescribing decision, follow-up plan, and the other health professionals notified. The next practice direction we'll take a look at is standard number 4, prescribing and dispensing. This states that pharmacists must provide a written prescription to the patient and must also give the patient the choice of having the prescription filled elsewhere. The patient may choose to have the prescription filled by the same pharmacy where it was prescribed, but this is absolutely their choice and they must not be swayed either way. It is important to remember that if the same pharmacist who wrote a prescription is now filling and dispensing it, this poses a potential safety issue and possible confirmation bias. It is always recommended that a second trained person confirms the accuracy of the dispensed drug. Nonetheless, a pharmacist still can dispense a drug that they prescribed based upon their own assessment if they believe that not doing so would compromise the patient's health. If the pharmacist is dispensing a drug that they prescribed based upon their own assessment, they must advise the patient or their agents that they can have the prescription filled at a different pharmacy. They must also give the patient enough information to facilitate informed decision-making. This includes discussing the benefits of having another pharmacist or healthcare professional review the appropriateness of the prescription. The pharmacist must be satisfied that the patient or their agent has the capacity to make an informed decision. The pharmacist must obtain the patient's or agent's informed consent to dispense the drug which he or she prescribed, and this informed consent must be documented. Pharmacists cannot refuse to prescribe a drug just because the patient or their agent refuses to have the prescription filled at the same pharmacy where it was prescribed. This practice direction also emphasizes the importance of documentation. The pharmacist must document and keep the record of consent to dispense, including who gave consent and the date of consent. If the person consenting is not the patient, then their relationship to the patient must be recorded. All this documentation must be available for regulatory review. The college also has practice directions on the sale of NAPRA Schedule II drugs and the sale of NAPRA Schedule III drugs. These contain more information regarding gathering information about the condition or symptoms to be treated. It's important to compare and contrast OTC counseling to self-limiting conditions prescribing. How are they different? The difference is not just that a prescription is written when prescribing for a self-limiting condition. After all, some self-limiting conditions may have OTC products as their best treatment. Differences, however, include that full privacy is a must for self-limiting condition prescribing, as opposed to being performed in the pharmacy aisle like for OTC recommendations. The assessment process must be more detailed, the follow-up more formalized, and thorough documentation is required. To ensure patient safety, Section 83 of the Pharmaceutical Regulation requires that members review each prescription for appropriateness of therapy, drug interactions, allergies, adverse drug reactions, intolerances, duplication, and the correct dosage, route, frequency, duration, and dose form. Furthermore, pharmacists are required to review the prescription and patient medication profile for any contraindicated drugs, any other errors, or potential drug therapy problems, and to ensure that the drug is prescribed within the prescriber's scope and consistent with standards of care and patient safety. These apply even when a pharmacist is the prescriber. The practice direction on ensuring patient safety notes that in gathering information, pharmacists should consider the condition of symptoms, previous history, length of present symptoms, disease states, allergies, sensitivities, current medication use, and other medications previously tried. Now let's take a look at the standard and practice direction on referring a patient, which directs that pharmacists must refer patients to another healthcare provider in the following cases. If the situation is or becomes beyond the scope or competence of the pharmacist, if the condition cannot be effectively treated within the practice of pharmacy, or if the condition has not adequately or appropriately responded to drug therapy or other therapy provided by the pharmacist. If a referral is necessary, the pharmacist must verbally let the patient or caregiver know about this. If the patient does not want to be referred, the pharmacist must discuss the implications of this decision on their care. Pharmacists must continue to provide care within any limits imposed by the patient's decision, not practice beyond their competence or scope, and document the patient's reason for referral if they provide one, the pharmacist's justification for referral, and any steps taken to educate the patient on this matter. The next practice direction we'll look at is on Standard of Practice number 12 from the regulation, records and information. This directs that the pharmacist and pharmacy owner must have records as required under the Act and regulation, and in a way that allows them to be easily accessed to comply with any legislation. Section 79 of the regulation states that signatures and initials must be original or electronic, records must be maintained for at least 5 years, and pharmacist documentation must adhere to all legislation and practice directions. It also must be clear, concise, and easy to read and retrieve. All records must be current and accurate. In hospital practice, documentation unique to pharmacy standards would be maintained, but information already appearing in patient charts does not need to be duplicated. The practice direction on patient counseling states the required dialogue that must occur when a drug is dispensed or sold to a patient for the first time. Counseling must focus on the patient's needs, assess for their understanding, and respond to the patient at the appropriate level. During patient counseling, pharmacists must confirm patient identity, identify the name, strength, and purpose of the drug, and give directions for use, including frequency, duration, and route. Identify the importance of adherence and what to do if doses are missed, as well as discuss common adverse effects, drug and food interactions, and contraindications, including how to avoid these and what to do if they occur. Patient counseling must also include a discussion of activities to avoid and storage requirements. You must also provide information about refills, monitoring response to therapy, expected outcomes, when to seek medical attention, and any other information unique to the drug or patient. The practice direction on pharmacy facilities states that you must provide a setting for confidential discussion between the patient and the pharmacist in community pharmacies. The setting must be free from any items for sale, other than those needed for the counseling session. This setting is ideal for assessments that may lead to a prescription as well as for counseling patients. The pharmacist will usually not be the only healthcare professional providing care to a patient. In cases where there are other healthcare providers involved, pharmacists should treat the other providers with respect, recognizing their skill, and communicating effectively with them. Pharmacists must also explain to the patient what the pharmacist's role and responsibility is in collaborative care. The foundational standard to all documentation and communication with or about a patient is confidentiality. Remember that pharmacists are trustees or employed by trustees under the Personal Health Information Act and thus must comply with this legislation. Now, we'll move on to the fundamentals of prescribing. There are 5 components fundamental to the act of prescribing. Remember, authorization should never be interpreted as obligation. As with any area of pharmacy practice, and according to Section 18 of the regulation, pharmacists have the responsibility to engage and perform only in those aspects of practice for which they have the requisite knowledge, skill, and judgment. Prescribing is no exception to that rule. Pharmacists must have professional judgment. This professionalism involves establishing a professional relationship with the patient and maintaining professional independence. This means pharmacists must refrain from prescribing for themselves or their family. Professionalism also involves working collaboratively with other healthcare professionals in the patient's best interests. Secondly, the pharmacist must have adequate information about the patient's specific health status to ensure that the decision to prescribe will maintain or enhance the patient's health. The pharmacist must obtain information to ensure the drug therapy is effective and that the patient is not placed at increased risk by the drug therapy. This means that a pharmacist must conduct a thorough assessment prior to prescribing and must only prescribe for a patient that they have seen and assessed in person or face to face. Pharmacists must provide a patient with sufficient information to enable the patient to make an informed decision about the product prescribed. The patient's consent is considered valid only if it is voluntary and made in advance by a well-informed individual who is believed to have the capacity to consent. When you inform patients of the drug therapy, this must include the nature of the treatment, effect, risks, and alternatives. If you can't confirm that the patient understands, you can refer the patient to another healthcare provider. Next, all drugs or devices prescribed must be for indications approved by Health Canada or be considered best or accepted practice in clinical peer-reviewed literature. The only exception to this is that pharmacists can prescribe drugs as part of an approved research protocol. Finally, all prescriptions must be written in a clear, concise, and easy-to-read format, and other healthcare professionals involved in the care of this patient must be notified as appropriate. As we discussed before, documentation is very important. Pharmacists must ensure that they retain a prescribing record of the above information. Documentation is very important because it contributes to continuity of care. It also helps pharmacists organize and accurately describe patient needs, pharmacist actions, and patient outcomes. Documentation records your critical thinking, describes events or discussions that occurred, and helps the pharmacy team provide better patient care. To ensure documentation reflects patient care most accurately, documentation must be done immediately after the activity. It must include all significant information, including what's deemed to support the identification of drug-related problems, recommendations, and decisions. Documentation must be clear, logical, and precise. Also, keep all documentation legible and non-erasable. Remember, all prescriptions must be written or typed, clear, signed, and contain all required information. Now let's move on to some of the aspects of prescription writing itself. The components of practically perfect prescribing that we will review include the thought, word, as well as drug and patient care. The thought that goes into writing a prescription includes asking oneself, is it the right drug, right dose, right patient, right reason, etc. Prescribing must also be within your scope of practice and within the limits of your knowledge and expertise. Next, you need to apply knowledge of pharmacology and evidence-based recommendations in selecting and monitoring drug therapy, as well as your knowledge of contraindications, drug-food interactions, side effects, and any other conditions or diseases your patient may have. Consulting and collaborating with other healthcare professionals and referring patients as appropriate is known as collaborative prescribing. If you have a patient in need but are unsure of what the best medication is, contact other members of the healthcare team. Collaborative prescribing is all about a team approach. Professional and respectful relationships are extremely important. All in all, research has shown that collaborative prescribing increases patient adherence. You also need to consult with the patient. They should know why you are prescribing what you are prescribing. If they don't agree with a treatment plan, they most likely will not follow it. The word of the prescription itself should be complete and legible. Again, remember that the patient cannot be required to have the prescription filled at your pharmacy or any other particular pharmacy. The choice is theirs. Also, you must not prescribe for yourself or your family. The Manitoba Institute for Patient Safety, or MIPS, is a local organization that offers resources for patients and healthcare providers to promote patient safety. One key program is the It's Safe to Ask program. It encourages patients to ask pharmacists and doctors about their medications. There are 3 questions they encourage patients to ask. What is my health problem? What do I need to do? And why do I need to do this? Patients should be able to answer these questions after receiving a prescription. MIPS also has a program called Patient Safety is in Your Hand that is aimed at prescribers. It is a series of posters that were created to raise awareness amongst prescribers about good and bad prescribing habits. While these posters will include medications that are outside most pharmacists' prescribing scope, they illustrate important lessons about writing prescriptions. In this example, the order on the bottom is an actual medication order taken from a patient chart. Remember that your patient has the right to choose where to fill the prescription. This means you should ensure that other pharmacists can also read your writing, since it won't necessarily be just you or your pharmacy staff reading it. This is a list of medical abbreviations and the associated error rate that they have produced. This is information collected from a study of medication errors based on abbreviations. You will see that QD, most frequently associated with errors, can be easily interpreted as once daily or 4 times daily. Units, the second worst, can be interpreted as extra zeros after the number. This poster is reminding prescribers to never use the abbreviation U for units and to always write out the full word. As you can see from the example of the order, it calls for heparin, 500 units or 5,000. There's quite a difference between the two. This one is again reminding prescribers to never use the abbreviation QD, as it can often be mistaken for QID or 4 times daily. As you can see from the example, it's easy to mistake QD and QID for one another. Make sure you're writing out the full word daily. Avoid abbreviating medication names, including abbreviations for different drug formulations like XR for extended release or SR for slow release. Write the generic name or the formulation out in full. Remember, what you might use in your daily practice might not necessarily be familiar to everyone else. This poster reminds prescribers to put the reason next to the order for PRN medications. So putting a reasonable dosage and indication on a PRN order is good practice so the patient knows how often they can take the medication and what condition is being treated. Simply putting 1 tablet PRN can lead to some misunderstandings for the patient and for the other healthcare professionals caring for that patient. A month later, a patient may not remember the recommended dosage regimen for taking the drug, not to mention why they were prescribed it in the first place. Always write out the words for subcutaneous and sublingual, as the two abbreviations can look very similar. The example shows an order for scopolamine, but it is unclear if it is SC subcutaneous or SL sublingual. This poster is very important to remember, as it is a very common mistake that can be deadly to patients. This one is about the danger of using trailing zeros on medication orders. A good way to remember it is to lead and not follow. So always use leading zeros for doses under 1 and never use trailing zeros for doses that are whole numbers. The example here for a Coumadin order shows that the trailing zero can mean that the patient gets 10 times the intended dose for warfarin or 1/10 of the intended dose. Both scenarios can be very detrimental to a patient. Always put the weight of the pediatric patient if it has any bearing on the dosage. This way, other pharmacy staff can double check that the dosage is right for the patient, so there is that extra safety net. Simply putting down the weight of the patient or the milligram per kilogram per day is also good. We've talked a lot about regulations and practice directions for prescribing, as well as best practices, but it's important to also have professional judgment. After all, the regulations don't dictate how many doses or days of therapy must be prescribed in most cases. They also don't take into account other unforeseeable factors that you may be aware of on the front line of patient care. It's of extreme importance to use your professional judgment to make choices that provide the best therapy for patients and that would be supported by a panel of your peers if any issues ever came up. Finally, remember that notification of other healthcare professionals may be appropriate. While it's not a requirement for prescribing medications for self-limiting conditions, it may be helpful on a case-by-case basis. This is an example of another area where you may need to use your professional judgment. Remember, notifying other healthcare professionals is a requirement for continued care prescriptions. Last but not least, let's look at the process of prescribing for self-limiting conditions. It's helpful to develop a process for prescribing for self-limiting conditions. This process can begin with identifying the patient's needs. Then explain the process. You could say, for example, as a pharmacist, I am able to prescribe medications such as this drug for your specific condition. We would need to sit down in private for about 10 to 15 minutes. Your input is important so we are able to determine the best course of action for you, which may involve a prescription. In this process, ensure that you obtain consent from the patient for an assessment. Next, establish the environment. Make sure the room or counseling area you're in is professional, clutter-free, and private. Then, conduct a detailed assessment by confirming contact information, medications, medical conditions, and allergies. Consider the patient's symptoms, using physical findings if applicable. Ask about duration and severity. Are the symptoms new or recurrent? Does the patient have any risk factors? What about previous treatment? Are there any red flags? After the assessment, make a recommendation, which may involve a prescription or referral or lifestyle suggestions. Pharmacists must create a shared decision-making environment, meaning you involve the patient in the decision-making. Review non-pharmacological recommendations and medication information when prescribing. Next, establish monitoring parameters and a plan which would involve the therapeutic goal or outcome. This must be measurable. There must also be a monitoring process, and you should decide who should monitor for what. Tell the patient what they should do if something happens. Ensure you set a follow-up date and decide who is responsible for follow-up. Setting a reminder can also be helpful. If appropriate, notify the primary care provider. When the time for follow-up comes, reach out to the patient. Throughout this process, ensure you maintain comprehensive documentation. To prescribe for the conditions listed in Schedule 3, you must complete this presentation in addition to the independent study readings and evaluation. Once you have successfully completed the Self-Limiting Conditions Independent Study Program for Manitoba Pharmacists and receive your statement of participation, fill out the appropriate application form and submit documentation to the college to receive authorization. To prescribe for smoking cessation, Pharmacists must complete an approved smoking cessation training program and view this presentation. Then, they must fill out the appropriate application form to submit to the college for authorization. Now that you've watched this presentation and may have completed or be near completion of one of the required programs, bear in mind that this does not grant automatic authorization. Pharmacists must apply to the college for authorization. Please visit the college website for the application and more details. These references were helpful in creating this presentation. Thank you for viewing this presentation. If you have any questions about this presentation or about prescribing for self-limiting conditions or smoking cessation, be sure to reach out to the college through the contact information on this slide.